Guy Benson, townhall.com political editor, and Julie Roginsky, Democratic strategist. Both are Fox News contributors. Guy, I saw you tweeting a couple minutes ago about what you were watching. What'd you think?
I'm not surprised given what happened all day today. Last night, I think some of the people that I spoke to on the Hill were optimistic. There might have been a breakthrough. Big meeting today, this morning at the White House with the Freedom Caucus. And then the president put another meeting on the calendar with the Tuesday group later in the day. And then Paul Ryan moved his press conference back and then postponed it again indefinitely. And it sort of felt like a postponement of the vote was next. And lo and behold, that's exactly what happened.
Yeah. Julie, is that your take as well? And it's this whole idea of trying to balance these two ends of the party. I mean, that's a story as old as politics.
You know, the part about this that makes it even more difficult for Republicans is once they reconcile this among these factions in the House, and that's not a big if, but it's somewhat of an if, they have to go to the Senate. And don't forget, they have a very small margin in the Senate in which to get this done by majority vote, never mind overcoming a filibuster. And even to get to 52, I'm not sure they'll be able to do that if this bill continues to move to the right. As they get rid of these essential benefits, you have a lot of moderate Republican senators who are not going to go along with it, and that becomes much more problematic to get to the president's desk,
Guy,
ultimately.
Let me ask about that, because why is that such a hard sell? I mean, we're all intelligent human beings. Don't we know enough to buy the insurance that makes sense for us? Why does the government have to mandate what's minimum in a policy? You know, if you're an older couple, you don't want to buy maternity care. You know, if you're younger, you're not going to select for certain things. That's what insurance is about, deciding for yourself what your family's risk is. I don't need the government to do that.
Yeah, I think it is definitely defendable, that piece of it, because just because you're getting rid of federal mandates, federal requirements nationally for all of this stuff to be covered, which makes coverage more expensive, doesn't mean that there aren't still state-level requirements. And to your point, as a single dude, I don't want to have to pay for pediatric dental care, for example. For a postmenopausal woman, she probably doesn't want to pay for maternity care. That drives up the cost, and getting rid of some of those national blanket requirements would make health care more affordable for a lot of people.
Yeah.
The issue here, though, politically, is Julie's right. Even if they get this eventually through the House, the Senate's going to completely change the bill. It's going to come back to the House. And then what? Ultimately, in 2009 and 2010, you had Democrats all over the place. Some of them wanted single payer. Some of them wanted a public option. Some of them wanted, they were nervous. They thought it was going too far. Eventually, they got them all marching in the same direction because they wanted to advance the ball for government. Republicans at some point have to decide whether or not they're going to get serious and govern and try to make improvements, or if they're just going to sit on the sidelines and snipe the way they have for 7 straight years on this.
Julie, I mean, everybody with 2 brain cells knows that this is the only opportunity for Republicans to get together and do something about this. Everyone in one way or another has hung their political career on getting something changed with Obamacare. If you're a Republican, it's collapsing. They have to know it's do or die. Don't you think? I mean, just putting your political hat on, if you were giving anyone advice, it's do or die. You've got to come to a deal, no?
Well, it depends who you are and who you're advising. If you're advising one of the 24 congressmen or women who are in districts that Hillary Clinton won, but you're a Republican, you're in a much different place than a Mark Meadows,
who may be
more
for
worried.
them if they don't repeal and replace? How could it be good for the people in those districts?
Because this replacement, and the Quinnipiac poll showed it today, is less popular than Obamacare ever was. It is very popular to say you want to get rid of Obamacare. Republicans have been saying it for 7 years. But the substance of this bill right now, in terms of the public perception, is toxic.
Nobody who Quinnipiac called has any idea what the substance of this bill is.
It doesn't matter.
Know that's not true.
But Melissa, the reality is, most people didn't know what the substance of Obamacare was either. They just liked it or they disliked it.
And they don't like it.
Well, I'll tell you something. When they find out the reality of this, especially the white working class that voted for Donald Trump, who will be hit drastically by the provisions in this bill, they will not like it either. As it is, these politicians look at polls religiously, as they should. They're up for re-election in a year or so, a year and a half, but they have to know.
This bill isn't even set. To know what the ramifications of what a deal would be, I mean, you can't say that people who voted for Trump are going to be unhappy with it. We have no idea what the final deal is going to look like.
Well, this bill is not getting more moderate. You have to concede that it's moving more and more to the right, and more popular provisions.
You don't have to concede that, because he actually went to go meet with the Tuesday group. So we were just arguing the opposite, that it's getting more moderate.
If it's getting more moderate, you could forget it ever passing in the House, because Mark Meadows will hold it hostage, and so will, and that's the problem.
I'll give you the last word. Julie thinks Republicans are damned if they do, damned if they don't.
Well, look, it's a tough situation politically, that's for sure. But Republicans have won 3 out of the last 4 national elections with really only one consistent, coherent message, with a lot of noise out there, and that was repeal and replace Obamacare.
Okay.
And the American people said, yes, please go do that. They've got to do it at some point. And if you're worried about your next election, what's the point of getting elected if you're not going to actually influence policy?
Guy Benson, it's like you don't live in Washington.